So we'll talk about the differences between two different conditions, right? That's inflammatory conditions, joint conditions. So this is pseudogout and the gout itself. Okay. So for me, if you say I should differentiate between pseudogout and gout, I'll just say pseudogout is simply what? Something that is kind of like looking like goat, but not really the main goat itself. You know. So you should know that all of them, they're actually what? Crystal-induced arthropathies. So they define the types of crystals, okay, and the joints affected, what actually causes it, and how to actually manage them. Okay, so you listen well. We'll start with the different features, we'll differentiate them, and the two conditions will now what? Compare and contrast. So for gout, the crystal you have there is what? Monosodium urate. While for the pseudogout, is known as a calcium pyrophosphate. What is there is a calcium pyrophosphate dihydrate. How about the cause? It's because uric acid is too much. So uric acid is coming from all this purine metabolism, and probably because your kidneys are not functioning very well to actually put them out. Why this one is caused by deposition of the calcium pyrophosphate crystals in the cartilages and also the synovium. So typical joints affected usually have what? The first metatarsophalangeal joints, those are the big toe joints, all of that. Ankle joint, the knee joint. This one, the knee joint, is commonly affected. Also the wrist, the shoulder, the hip, the ankle, the elbow. So this one, the onset is sudden, severe pain, swelling, redness, and the rest of it. Why this other one? There's sudden painful swelling. Okay. Warmth, stiffness, the rest of it. Okay. So these are the risk factors are common in males, middle age, someone is obese, they take alcohol. Why this other one? Is usually when the age is actually what gone past 65 years. So this is the basis of trying to diagnose. Okay, that's the basis of trying to diagnose, and the treatment options. Okay, and also how to prevent. Okay, so on the basis of this, I think that's the differences we have between the two conditions. If you are asked to differentiate between gout and pseudogout, these are the headings you use in differentiating all of this, and you move ahead. Okay, so gout is strongly linked to your lifestyle and metabolic syndrome, while pseudogout is more common in the elderly people. Okay, and mimics what? Osteoarthritis. Alright, so that's what we got.